The top story right now is this new variant of COVID, the Omicron variant that we don't know an awful lot about yet. The president says we should be concerned, but there isn't a reason to panic. And I think part of that is we really don't know much about it at this point. We don't know if it's more contagious or not, or if the symptoms are worse or not. But hopefully in the coming weeks, that's what the general focus of, the medical community, the research community around the globe will be, is figuring out just how to handle this new variant. Yeah, we're in sort of a holding pattern, Anne-Marie, as you say, because we are still trying to learn more and find out more about the Omicron coronavirus. And so that is something that that the doctors and Dr. Anthony Fauci and others have been talking about. So let's get into it with the race to find out more about this coronavirus variant. The strain was first identified in South Africa and has been detected in at least 19 countries or territories. Health officials are warning it could already be here in the United States. Amid all of this, the CDC has shifted its language on booster shots. The agency initially said all adults may get a booster. Now officials say eligible Americans should get the booster. Deborah Patta reports from South Africa, where researchers are working furiously to study the new strain.
This is ground zero for Omicron. Scientists in this high-risk biohazard lab arm themselves for another day on the COVID battlefront. They are hot on the trail of the new mutant strain circling the globe.
Zay, I'm coming to give you a cryo box from the freezer.
Here, they are growing live Omicron, which will be tested against the blood of fully vaccinated people, as well as those who were previously infected. Heading up this team at the Africa Health Research Institute is virologist Alex Segal.
This is probably the most mutated virus we'd ever seen.
The variant has more than 50 mutations, over 30 in the spike protein, making it easier to attach itself to human cells.
It's more of a Frankenstein than others, but it's always something new. I mean, the virus keeps surprising us.
Now they are collaborating with other scientists to determine if the variant blunts vaccine immunity.
This lab has received multiple requests for samples of Omicron, which are being packed to be shipped off to other research institutes around the country.
Infectious disease expert Richard Lessels works next door at the sequencing lab that helped identify the new variant and is studying the spread of Omicron in real time.
What's critical now over the next week or two is to really see in the data what the pattern is there. Is there an increasing rate of infections in the vaccinated, and what is the severity of disease in those individuals?
Segal believes Omicron has been clocking up evolutionary changes for well over 6 months now by lurking in an immune-compromised person who was unable to clear a COVID infection. He warns as long as Africa lags behind in vaccinations, this won't be the last mutation.
We're going to learn together the rest of the Greek alphabet. Unless we understand why these variants evolve, how they evolve, and be able to predict them.
There's been an uptick in infections amongst young people in South Africa, but these scientists believe existing vaccines will protect against serious illness and hospitalizations. They'll have those answers in less than 10 days. Vlad, Anne-Marie?
All right, Deborah, thank you very much. Dr. Dyan Hes is here now with us. She's the founder of Gramercy Pediatrics in New York City. So, Doctor, there are growing questions, as you know, about the effectiveness of the current vaccines against the Omicron variant. The CEO of the drug-making company Moderna has recently said current vaccines are unlikely to be as effective against Omicron. So what do you make of this assessment? But I guess more importantly, isn't the message then that we continue to wear masks, at least when feasible, that we wash our hands, that we continue to practice social distancing, and more importantly, that you just at least get the vaccine? It may not be 100% effective, but it's better than not being vaccinated at all. Is that right, or am I wrong?
No, you're completely right. You could do the show, Vlad. I think that, we're all trying to have a crystal ball and predict what's going to happen. And the one bottom line thing that we know is get your vaccine. I don't even think the booster as important as let's vaccinate all those unvaccinated. Let's find out why they're still vaccine hesitant and let's get them vaccinated, because this is still a pandemic across the globe of unvaccinated patients. This virus was able to mutate in an immunocompromised patient who was not vaccinated. or the vaccine was not effective because they were immunocompromised. So let's get all our healthy people who are eligible for the vaccine, which is about, only about 68% of American adults are vaccinated. Let's get them vaccinated. I think the booster will help, but I think at least if we get everybody to get at least one vaccine now, we can slow this pandemic again. I mean, we're going to be chasing our tails for the rest of our lives. And I think that's what upsets people. It's that there is no end in sight because viruses mutate, and this virus is extremely virulent, as we know. We don't know if Omicron is more virulent than Delta. We know that it has more mutations, but that doesn't mean clinically it's going to be worse in patients or more contagious. In 2 weeks from now, we'll have more information.
CBS News correspondent Nancy Cordes spoke with the director for the Center for Infectious Disease Research and Policy, Dr. Michael Osterholm, about the risk COVID-19 still poses for the U.S. I want to play a little bit of what he had to say.
People don't realize we're more susceptible today in this country as a whole because of the number of people who are now 6, 7, or 8 months out who have not gotten their boosters and who are now starting to revert back to a much higher risk.
How concerned are you as a physician about another wave of cases, in particular as, we have a new variant that's being investigated?
I'm concerned. I mean, I have to have some little bit of optimism that in my population where I work, the children are getting vaccinated and the children are doing better. I don't know. We don't know if a booster is going to help this. And I could recommend it, but I can't say 100%. Like, people want to know data. And I can't say that this booster is going to reduce your chances of getting Omicron. What we know is the vaccine keeps you out of the hospital and keeps you from getting very ill. So if you had no problems with the first two, I don't believe that you will have a problem with the booster. I got my booster when my son turns 18 in a month. He's going to get his booster, but there are no guarantees. This is the only weapon we have right now. So why wouldn't you take it if it's offered to you? Why would you risk getting COVID when you could end up in the hospital on a ventilator and, fighting and demanding experimental drugs to stay alive instead of taking a vaccine that has been proven that is so effective? I mean, in adolescents, the reduction of hospitalization in children with COVID in America is 93%. 93%. There were no ICU admissions in any child who had 2 vaccinations. So I have to still recommend it, still encourage boosters, and follow the science. And maybe in 2 weeks from now, I will have more things to tell you.
Dr. Hes, I'm very interested in how, A, these viruses mutate, and B, how contagious they are. And I was thinking back to 2002 when we, as a planet, were first dealing with SARS-CoV-1, which by a couple of years after 2004 or so was largely not a threat to people anymore. And one of the things that I thought was interesting is that what all officials say is that public health measures instituted by governments largely contributed to the demise of SARS-CoV-1, and also the fact that most people were highly contagious when they were sick. I guess the difference here being that you don't know that you're infected, so that makes it harder to control. But why is the virus mutating so quickly? Is it because you have a population of folks that are vaccinated and unvaccinated? Is it because that there are people who are, I'm just trying to understand why these mutations are happening, because my fear is that, as you just said, that we're going to be sort of reliving this every year as more variants appear.
I'm not a virologist. It really is that the virus has a change in its DNA sequence, like the actual amino acids change, and the virus is smart. It's trying to replicate, and when it can't replicate, it finds out why it can't replicate, and it mutates. I mean, we see this with flu every year, and that's why we get a different flu shot every year. So it's not rare for viruses to mutate. It's not because of the vaccine. It's just because that we don't want to be sick, and the more more that are vaccinated, it can't replicate. So the virus is going to try to find its way, a loophole. Let's say like a loophole, and try to find a way to replicate. I am not a virologist, so that might not be the best explanation, but that's the only one I can probably give at this point. So it's still this. But we know that the people who are going to get this virus, who are going to be the sickest, are the unvaccinated. So we need to get vaccinations. If we all are vaccinated, it won't have to mutate because it won't have anybody to infect. That's a better way to look at it.
So what you are is a pediatrician. So I want to ask you for some advice for parents. A lot of kids have gone away. They've gathered for Thanksgiving. They're going to head back into classes, and then it'll be a few more weeks, and they'll be back again gathering with extended family members for the holiday season, for Christmas and so on. Advice. Best practices, things that you want parents to, remind their kids to do or drill into them to keep them protected. I guess not just from COVID, but, it's flu season as well.
Yeah, just, good hand washing. If you can be outdoors, like ice skating is a great activity in the winter, skiing is a great activity, taking long walks with your friends, bundling up. Indoor activities, we're going to probably see a rise in COVID cases, especially in the under age 5, because they're not immunized, but they want to socialize and they want to be with their friends. Really mask wearing if you're over age 5 for sure. Indoors now in New York City, they're recommending that everyone wears masks when they're indoors again. And just having good judgment. If you have a friend who's not vaccinated, do not have a play date with them indoors without masks, because you're going to expose your family and and just ask a simple question. How are you feeling? If you're not feeling well, let's stay home. I mean, right now in New York City, we're having a much, much bigger problem with enteroviral stomatitis, which is Coxsackie virus, that all the kids are having it right now. And the masks are not preventing it because little kids don't wear masks well, and they're always wet on their face. So I think, it's just like you said, there's flu going around. We haven't seen so much flu in New York City, but just ask questions and just use your good judgment.
You can't beat that. That's some common sense stuff. Dr. Dyan Hes, thank you very much.
Thank you.